Researchers from Boston Children's Hospital used OpenAI's O3 model to identify 18 diagnoses for children with rare diseases that doctors had missed. These were real children. Real diagnoses. Real answers that medicine could not find. Here is the complete story. This video is part 2 of my AI medicine series. If you watched my earlier video on GPT-5 solving a 3-year medical mystery, this is the same category, at a completely different scale. Not one case. 18 cases. Not one patient. 18 children. All at one of the most respected pediatric hospitals in the world. Boston Children's Hospital. All using the same AI model, OpenAI O3. Here is what happened and what it means. Rare diseases are not rare in aggregate. Over 300 million people worldwide live with a rare disease. More than 70% of rare diseases are genetic. More than 70% begin in childhood. But rare disease diagnosis is one of the hardest problems in medicine. The average rare disease patient sees 8 different specialists. The average time to a correct diagnosis, 7 years. 7 years of a child's life, without a name for what is wrong. Without a treatment pathway. Without answers. The reason diagnosis is so difficult is structural. There are over 7,000 known rare diseases. No single doctor, no matter how experienced, can develop the clinical pattern recognition for thousands of conditions they may see only once or twice in an entire career. The knowledge exists in the literature. The ability to recognize the pattern in a single patient, often does not. That gap between what medicine knows and what any individual doctor can recall is exactly where AI like O3 can operate. OpenAI O3 is a reasoning model. Not just a language model. It does not just retrieve, it reasons through complex multi-step problems. In a medical context, this distinction matters enormously. A doctor seeing a child with unusual symptoms searches their own experience. Then searches the literature they can recall. Then refers to a specialist who does the same. This process can take months. Years. O3 was given patient information, symptoms, test results, history, and reasoned through the full body of published medical literature simultaneously. Not retrieving one answer. Building a differential diagnosis across thousands of possible conditions. Finding the patterns that matched. In 18 cases, it found a match the medical process had not. Not a guess. A diagnosis that could be investigated, tested, and confirmed. The model did not replace the doctors. It found what the doctors had not yet found, then handed the diagnosis back to the clinical team to verify. That is the right model for AI in medicine. Augment, not replace. 18 children. 18 families who have been waiting for an answer. Some of these families may have been waiting years. For a rare disease, a correct diagnosis is not just information. It is often the difference between a treatment that works and a treatment that misses the target. Between understanding what to watch for, and being caught by surprise. Between being in a clinical trial for the right condition, and waiting years longer. The research coming out of Boston Children's Hospital is significant because it was not a theoretical demonstration. These were real clinical cases. Cases that had already gone through the standard medical process. Cases that the standard process had not resolved. The AI found what the process missed. That is a repeatable, scalable finding. 18 is not the limit. 18 is the beginning. If you are a parent with a child who has an undiagnosed condition, this video is for you. What this research tells us, AI reasoning models trained on medical literature can now serve as a second opinion at a scale no specialist panel can match. The knowledge exists. The pattern recognition exists. The tool now exists. The gap that kept thousands of families waiting years for a diagnosis, is shrinking. This does not mean you put a child's symptoms into a chatbot and act on it. It means the medical system now has tools that can catch what the system previously missed. The right use is doctor plus AI, not AI instead of doctor. But the doctor plus AI combination, at institutions like Boston Children's Hospital, is already finding answers that doctor alone could not. For families with children in the diagnostic odyssey, advocate for AI-assisted diagnosis at your institution. This research gives you the evidence to do that. This result fits a pattern that has been building across medicine. AI models trained on imaging have matched or exceeded specialist radiologists on certain cancer scans. AI has matched dermatologists at detecting melanoma from photographs. AI has read EKGs to detect conditions cardiologists missed. But rare disease diagnosis in children represents something different. It is not a pattern recognition task on images. It is multi-source reasoning, combining symptoms, genetics, history, lab results, and literature. That is a harder problem. The fact that O3 is succeeding at this harder problem means the potential scope of AI in medicine is wider than most people have understood. 18 children at one hospital is a signal. A signal that the tool works at the hardest edge of the problem. If it works there, it will work everywhere easier than that. Medicine has always been limited by what any one doctor could know. 7,000 rare diseases. Millions of published studies. One human brain trying to hold it all. That was always an unfair burden on both the doctor and the patient. AI does not replace the doctor. It gives the doctor access to the full weight of what medicine collectively knows. In 18 cases at Boston Children's Hospital, that made the difference. This is what AI in medicine should look like. Not replacement. Access. If your child has an undiagnosed condition, this video is for you. Share it with every parent you know. Subscribe for AI news in 2026. Comment below, do you think AI should be part of every rare disease diagnostic process? I am reading every response.